Mr. Barnes, what do you expect to achieve with this project? So what will be the ultimate goal?
Well, I think that with a project like the Open Pharmacology Space Call, we really want to look at ways to integrate public domain resources using common standards so that we can improve the quality of public domain drug discovery data. And then by working as a large consortium with industry and with academia and SMEs, we're really hoping that we can start to bring more industry data into the public domain and to improve the way that we deal with data around targets and around small molecules and drugs. So really looking at the interface between targets and drugs. So what we actually hope to achieve is basically to get a resource in the public domain that will be a sort of bedrock for doing drug discovery, and that could be for industry or it could be for academia. What we really want to do is to try and sort of level the playing field so that everyone can actually do drug discovery.
Just to clarify a bit, could you perhaps with an example explain what could be the benefit for the patient of this?
So I think a good sort of example of a benefit is by making information about drugs and about targets of drugs available, then we could actually open up drug discovery to smaller patient groups. So a good example is orphan diseases. So if you might have a very rare monogenic or Mendelian disease that might only have a few, 100 or a few thousand sufferers, it would give access to patient groups and to charities and to academics. It would give access to data about drugs and about drug targets so that they could actually use that information perhaps to design phase 1, phase 2 trials for those diseases.
Okay, thank you. Now, in very concrete terms, what would be the contribution of the industry in this project?
So industry is going to really bring several things to this. It's going to bring knowledge of drug discovery and know-how of drug discovery. And some of that's in the public domain already, but it will really add to that and bring up the level of knowledge in the public domain. We'll also bring standards for drug discovery and tools as well. So we have some tools that we could open source and get those in the public domain and improve the toolkit. And also, we'll bring in expertise around managing large projects and managing large consortia.
Okay, thank you. Now, why would academic teams or small companies, SMEs, take part in this project? What is in it for them?
Well, I would hope that they'll find it interesting because it's a good opportunity to work with a large number of pharmaceutical companies to get an idea of what's important for pharmaceutical companies and also for them to get access to more knowledge and know-how about drug discovery. And we can learn from each other. There's no doubt that we'll do a lot of learning from each other. So, I think it's just it'll be a good team to work in.
Okay, thank you very much.